Is your skin trying to tell you something about your kidneys? These small clues on the surface could be whispering serious warnings about your internal health, and most people miss them completely. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're diving into something most of us overlook: the surprising ways kidney disease can show up on your skin. Your kidneys work 24/7 to filter waste from your blood, maintain fluid balance, and help regulate key minerals like calcium and phosphorus. But when they're in distress, they sometimes don't send loud alarms, just quiet, persistent skin changes you may not associate with kidney problems at all. Let's start with pruritus, an intense, persistent itch that's not caused by anything visible like a rash. I had a patient once who came in complaining about dry, itchy skin that had kept her up for weeks. No matter how many moisturizers she used, nothing helped. Turns out, she was in the early stages of chronic kidney disease. Her kidneys weren't processing toxins properly, and they were literally irritating her skin from the inside out. Doctors call it uremic pruritus, and it affects as many as 9 out of 10 patients with advanced kidney disease. Interestingly, this type of itch doesn't respond to antihistamines because it's caused by nerve irritation and chemical imbalances in the blood, not allergies. If this sounds familiar to you, don't ignore it. It's a sign worth looking into. Another sign? Extremely dry skin, called xerosis. Dry skin might seem normal in winter, but when it becomes constant, flaky, or tight-feeling all year round, even with regular moisturizing, it could be something more. A surprising number of people with kidney disease experience this. That's because compromised kidney function affects your oil and sweat gland balance and disrupts your skin's ability to maintain moisture. Here's something you can try at home if you're dealing with unexplained dry skin or itching. Switch to fragrance-free skincare products. Use a humidifier in your bedroom and apply moisturizing creams immediately after showering to lock in hydration. These tips won't cure kidney issues, but they can help relieve symptoms while you follow up with a healthcare provider. There's also the issue of skin color changes. Some people with kidney dysfunction notice their skin turning pale, grayish, or even yellowish. These color shifts can result from waste buildup in the blood or low red blood cell counts related to kidney disease, known as renal anemia. Hyperpigmentation or areas of darker skin, especially on the shins and face, can also be a red flag. Have you ever looked at your nails and noticed unusual patterns? Half and half nails are one of the most striking signs, where the bottom half is dark and the top half is pale or white. It's not just a cosmetic quirk, it can be tied to protein imbalances and chronic kidney issues. Another pattern, called Muir's lines, horizontal white bands across the nails, can signal a drop in blood proteins, again linking back to kidney health. Swelling, especially in your legs, ankles, or around the eyes in the morning, is another cue. This kind of puffiness, called edema, happens when kidneys can't filter out excess fluids effectively, letting them build up in your tissues. A good check is to gently press the swollen spot. If it leaves an indentation that lingers, that's pitting edema and it needs medical attention. Of course, not every rash or swelling means kidney disease, but the patterns and context matter. If multiple symptoms line up, it's worth getting checked. And even if only one seems familiar, awareness is powerful. At UB Health, we believe your body gives you warning signs. You just have to know where to look. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this video helpful, make sure to like, follow, and share for more doctor-approved info you can trust from UB Health. See you next time.